All right, welcome everyone to our open enrollment town hall. Thank you all for joining us today. We're really excited to jump into these series of open enrollment town halls. Many of you may have joined us for our American Rescue Plan Act health insurance town halls. And as we shift towards open enrollment on November 1st, we thought it would be a good idea to try and get information out that is specific to the open enrollment period and the information you need to know during that period. We're going to be going over a variety of different aspects of open enrollment. We've got our carriers on the call today to do an overview. And this is the first of a series of 4 different open enrollment presentations that we're going to be presenting over the course of open enrollment that lasts until January 15th. So it starts November 1st and goes until January 15th, 2022. So open enrollment is that time of the year when you can sign up for a plan, a health plan for the next calendar year. And a lot of important things to consider this year, as many of you already know. So today I am joined by Sean Sheehan, who will be helping navigate through a lot of this information. And welcome, Sean, welcome, carriers. And without further ado, I actually just want to review some of the housekeeping pieces about Q&A. So if you do have a question, you are more than welcome to type it into the chat at any time. It can be for one of our presenters or for Sean or myself, and we will try and answer all the questions that we can at this point in time, during the course of the event. And yeah, feel free to ask away. So why don't we jump right into today's presentation about open enrollment. So just recapping what I started with, we've got this series of 4 open enrollment town halls. Today is going to be the high level one, talking about health insurance basics and things you need to know to get started with open enrollment. On November 17th, also at 12 p.m., we'll be having a health insurance literacy town hall. So that's going to focus more on specific terminology and specific details about health insurance that may go a little bit more in depth than folks are familiar with. So that's a good one to tune into if you want to learn more about those details. On December 8th, we're going to go into how to choose the plan that's best for you. So that's going to dive deeper into plan selection. And many folks may want to tune into this one because it is really going to help folks figure out how to decide, which plan is going to be best for them. We've got a lot of plans out there. If you use the plan comparison tool, or if you've reviewed our website, you can see all of the options, and that can be overwhelming for folks. There's ways that we can kind of filter through these options and really narrow down different elements that can make it a little bit easier to decide which plan is going to be good for you and or your family. So tune into that one if you're interested in that information. And then lastly, we're going to kind of recap everything right before the end of open enrollment on January 5th, just summarizing all of the information that we've covered during open enrollment, and also that'll give us another time to answer any questions that Vermonters might have about the plans that are being offered or the process for open enrollment this year. So today, like I mentioned before, we're going to talk about how to get started, what you need to be thinking about when it comes to open enrollment. We're going to cover some of those really kind of important fundamental pieces of health insurance. So Health Insurance 101, we're calling that. We're going to cover the important dates that you really need to keep in mind when you're thinking about open enrollment for this coming plan year. Again, we're going to go over some of that health insurance terminology. There's some specific key things that are different for 2022. Many of you who have tuned into our health insurance town halls have a sneak peek into what those differences may be. But there's some more differences that will be important to communicate to you. We're going to have, of course, our insurance companies present an overview of what they have to offer in this plan year, and then allow time for questions if they arise. So when we think about where to start with health insurance, and I'm going to let Sean kind of elaborate on this, but there's some really important places that it's good to know about on our website, and our website can really serve as a hub for a lot of the information that you need to know. So Sean, I don't know if you want to jump in here and kind of walk us through this website landing page and what folks may want to really tune into here.
Yeah, I'd be happy to, Zach. And at the same time, I think I'd also emphasize your point or suggestion for people to type in any questions they have, because I think in an overview event like this, we're trying to be all things to all people, recognizing that we have some people who are already Vermont Health Connect members will know a lot of this stuff. Other people who have been direct enrolled in their insurance plans with their insurance companies, but now are coming to look to transfer their plan to take advantage of the more generous financial help that's available to people with much higher incomes through the American Rescue Plan, and then people who maybe haven't had insurance before or in a long time and are trying to understand the basics. So we'll try to cover a lot of that to the extent you put in questions. Zach and I and the folks from the insurance companies can speak to those points as well. But at a high level, pointing to the website here, as you have, Zach, just to point out three links, and there's a lot more than three on the page there. You can check them all out, but if I had to pick three, number one would be the plan comparison tool. As Zach just pointed the arrow there, it has the shopping cart, and that's a great resource for really trying to distill down. First, find out with your income and household size what financial help you'll qualify for, so that to see what plans will actually cost for you. After, looking not just at their gross premium price, but actually what they'll cost after your financial help, and then being able to then kind of sort out some of the things we'll be talking about, some terms we'll talk a little bit more about with metal level and insurance company, and certainly we'll be hearing from Blue Cross and MVP on that. But plan comparison tool is a great place to start. A second link right there is the Learn How the American Rescue Plan Act lowers insurance costs. If you click on that American Rescue Plan Act, it'll come to a page which will help you get to the specific situation we're talking about, because everyone who buys plans on their own or is uninsured may be able to get get help, get resources here, but the steps you take might be a little bit different. Clicking on that American Rescue Plan Act link will get you to the right spot for your situation. And then third, if you don't like websites or you can't find what you want on this one, there's lots of other ways to get help as well. There's the customer support center, the toll-free phone numbers right there. They're usually open 8 to 4:30 Monday to Friday. They're open 8 to 5 during open enrollment, and have a couple special weekend days as we get closer to some of the deadlines that they're open as well. And then if you prefer to talk to somebody in person, or in the age of COVID, it's not always in person, but at least somebody in your community, we have local assisters who are trained and work in all 14 counties of Vermont. And if you click on that link or call the customer support center, they can connect you with somebody there, often who work at a lot of the hospitals and health clinics. And that's a great way to really have that one-on-one attention. Again, a lot more on the website. We'll get to some of the rest of it here, but those are three great places to start.
Thanks, Sean. And just to kind of reiterate what Sean's saying, if you go to actually, the top of the website here, you can learn more details about how to get information about open enrollment and general health insurance information, both at the Find Local Help links and the Learn More links. If you are someone who's a little bit more interested in using our website, both of those links are going to direct you to resources that you have at your fingertips. And I want to just dive in a little bit more to those just so that people are aware of them. So when you go to the Find Local Help link, this is a snapshot of what will come up for you. So you can see in the left navigation bar, it says Find Local Help. And then we've clicked on educational materials here. The educational materials have a variety of different resources, including, a basic health insurance 101 single sheet. We've got posters. We've got general information here about what health insurance is and why it's important. So we'd really encourage people to take a look at those links, and you can always, share these as you feel appropriate. And we found that this is a really good place for folks to have access to. The second place is when you go to the Learn More link at the top, you can choose a variety of different options. And here we've clicked Health Insurance Basics. And this is probably a good segue for us to kind of dive into a little bit of some really key terminology that we think folks might want to know about when it comes to health insurance and diving into health insurance. We've picked just a handful here because if you're new to health insurance or new to understanding health insurance more thoroughly, these are ones that are going to come up for you probably regardless of what direction you go. And it's really important that you understand these terms. But what we've highlighted here is a list of terms, which is kind of a glossary on our web page that really encapsulates just about all of the common health insurance terms that you'll need to know when navigating our website and talking to the health insurance companies and our customer support center or an assister. So this can be a really helpful tool for folks who are kind of just diving in well. But before we go to the next page, Sean, maybe you can kind of touch on these ones that we've called out here, and dive in a little deeper there. Yeah,
be happy to, Zach. And as we said, so I think these are a few terms which I think will be helpful when we hear the presentations from our insurance company partners. And I know we try not to speak in acronyms and too technical, but I'm sure we will in some cases. So as Zach references, this glossary, this health insurance terms, is a good reference sheet. Premiums is a term that some folks know from other forms of insurance too. It's basically your monthly bill. It's what you pay each month, whether you use care that month or not. It's what keeps your insurance active. And you might hear gross premium and net premium. Gross premium is the full price for that for your health plan or your dental plan, but the health plan skipping down, I'll bounce around on these, but the advanced premium tax credit and the Vermont premium assistance are a couple of the forms of financial help, which are much more generous now for 2021 and 2022. So there will often be a big difference between your gross premium, what that plan would cost somebody who is making $1 million a year and what it will cost others, individuals making up to $105,000 or people in family plans up to nearly $300,000. The term copay, that refers to when you use healthcare. There's some services you'll find that don't have any copays. Preventive care doesn't have any copays with any of the health plans you buy through the marketplace of Vermont Health Connect here. But some plans will have a copay, and that would be a dollar value, say $15 or $20 specified for your plan to see a specialist to get a different various services. And co-insurance is similar to copay. It's what you use when you pay when you use your healthcare But while copay is a flat dollar amount, coinsurance is often a breakdown. So maybe for inpatient care, your health plan, your insurance company will pay 60% of the cost, and you will pay 40% of the cost. So that 40% would be coinsurance. And those percentages are different with different plans, and deductibles are also different with different plans. The deductible is typically what you will pay for healthcare and services and prescriptions that aren't some have the deductible waived, like we mentioned, the preventive care, but those that don't, you would pay you'd pay a full cost of that up to the deductible. Then after deductible hits, you would be paying the cost sharing, which is the copays and the coinsurance, up until the maximum out of pocket, which is another key term we didn't have on the list here. After you reach that maximum out of pocket, that's when your insurance company pays for 100% of covered services. So that's what really gives you that protection against the big medical debt and the medical bankruptcies that we heard so much about prior to the Affordable Care Act. And finally, metal levels are something that you'll hear you'll see on the plan comparison tool, and you'll hear when the insurance companies, at least when Blue Cross and MVP talk about the health plans. They go from bronze, silver, gold to platinum. Two key things, important things to know, is that there's not a difference in covered services. In other words, a platinum plan won't cover a whole bunch of services that a bronze plan won't. They all cover the same essential health benefits. The difference really comes down to how you pay for them. And a bronze plan typically will have higher out-of-pocket costs, higher deductibles, a higher maximum out-of-pocket, but that monthly premium, your monthly bill, will be very low. And for many people at many incomes, it could be a $0 premium. A platinum plan, on the other hand, will have a higher monthly bill, a higher premium, but much lower out-of-pocket costs, lower deductible when you use your care. So people who are more risk averse or tend to not be as healthy might be more likely to choose a gold or platinum plan, while as somebody who's younger, somebody who's more open to having some risk or has a plan to take care of their costs, may be more open to a bronze plan. And the big caveat, the big asterisk I'd give on metal levels, is when you use the plan comparison tool and you see your financial help, you might see you qualify for silver 94 or silver 87. If you see those, your metal level decision just got a lot easier. What it basically means is you can get a silver plan under the American Rescue Plan now for probably close to $0, likely under $10, and it'll have a out-of-pocket costs that are lower than gold and platinum plans. So if you see that silver 87 or 94, you shouldn't be getting a gold or platinum, and you're likely better off in a silver plan too. And the issuers will talk more about that. We'll talk more in these other stages. You can ask questions, but I think those are, I don't know if there's any other key points you'd point out there, Zach, of these terms.
Yeah, I think that's a great intro, Sean, and I agree. I think when we get into plan selection, we'll want to talk more about those enhanced silver plans. But just to make sure that we stay on track, let's jump into some important dates for 2021 for 2022 open enrollment that starts November 1st, just next Monday. So next Monday,
big four, right?
What's that?
These are the big 4 dates. You got them up. Everyone should circle these dates like you got them circled here.
Exactly, the big four. So yes, as usual, open enrollment is starting on November 1st, this Monday. That means that folks can enroll online. They can call, but open enrollment is open beginning Monday, November 1st. This year, I'm going to skip ahead. Instead of closing as we did last year on December 15th, open enrollment actually stays open until January 15th this year. So we have a month longer open enrollment period this year. So that should allow folks a little bit more time to get enrolled. But I want to go back to this 12/15 date, December 15th. So December 15th is still a really important date. And it's really important because that is the last day that a customer can enroll during open enrollment and get a plan that is effective on January 1st, 2022. If they enroll after that 12/15, that December 15th date, they would not be, and they enroll before the end of open enrollment, they would not be looking at a plan that starts before February 1st. So again, to get that 1/1 start date, that January 1st, 2022 start date, folks will have to enroll during open enrollment between November 1st and December 15th.
Right. So if you're watching this live today or watching it in the next month and a half, you can forget about that 1/15 date. Just look at the first three, right? Those are the key dates to make sure you have the peace of mind that comes with insurance and are getting these new benefits for all 12 months of next year. It's great that the open enrollment is extended, and so if you're talking to people over the holidays and they missed out and don't have insurance and don't know about the extra financial help, that would be great to tell them about 1/15 then. But till then, we can kind of put it aside, right?
Exactly. So Sean, maybe you can jump right into this about what's different for 2022.
Yeah, absolutely. And I'll just hit this real quickly. One is, I think I alluded to them both and want to make sure we get to our insurance company partners. But number one is, if you talk to people, and we know that most people who aren't insured in Vermont, we're fortunate to have one of the lowest uninsured rates in the state. But the few people that aren't insured, typically they say it's because they can't afford insurance. And oftentimes it was because their income was just a little bit too high to get financial help before, or the financial help they got wasn't enough. The American Rescue Plan passed last March, good for all of 2021 and 2022, gives a lot more financial help to people who are already getting it, and it gets rid of that benefit cliff that there used to be, and does a phase out, so people at much higher incomes can get some financial help. And what that means is, for 2022, you could be an individual. If you're in a single plan earning $105,000, you would still get some financial help. And people in family plans up to $297,000 can qualify for financial help. And so people who are direct enrolled with insurance companies, they have to come over to Vermont Health Connect. They can transfer their plan at any time, but doing it sooner is better, because you get these tax credits for every month you're enrolled. So that's one big point. And again, the plan comparison tool can tell you exactly what your situation is if you put in your income and household size. And secondly, one piece that I think for people maybe who were direct enrolled, one thing they liked about being direct enrolled was they were able to pay their insurance company directly, and not have to send a payment to Vermont Health Connect to then send it over to the insurance companies, and lots of points of contacts and potential for confusion, particularly in the early years. That's all changing as of the first bill for 2022. The bill that the insurance companies send out on December 10th will come directly from the insurance companies, won't come from Vermont Health Connect, and you will pay the insurance companies directly for that bill and every subsequent bill for 2022. So for the rest of 2021, and if you have a balance for 2021, you'll continue to pay Vermont Health Connect. We'll continue to pay the insurance companies on your behalf. But starting in December, starting with your 2022 bill, you'll pay the insurance companies directly. So you'll look for more information in the mail. When you sign up, you still sign up through Vermont Health Connect the same way. You'll still get the financial help. We'll send that financial help to the insurance companies. They'll have that gross premium and net premium we talked about on their bill, but you'll get to pay them directly.
Thanks, Sean. And I think that's a great segue. Speaking of carriers to go to our carrier representatives. I am just going to take a minute and well, why don't we go ahead and we can start with Blue Cross Blue Shield actually, and as you begin to introduce yourself, Blue Cross, I will bring up your presentation. And so we have Jordan Benson here today, who's going to do an overview for Blue Cross. And go ahead and take it away, Jordan, while I bring up your slide deck.
All right, thanks, Zach. Hi, my name is Jordan Benson. I'm one of the consultants at Blue Cross Blue Shield Vermont for our qualified health plan market. So thanks for having me today, and we'll quickly go over what our products include for options for 2022.
So Jordan, hopefully you can see your deck is live.
Yes, yep, thanks, Zach. So you can proceed to the next slide. So as Sean and Zach have mentioned, there are meta levels with the products that we offer. And we have 3 different plan types. We offer Vermont Preferred and Vermont Select, also known as non-standard products. And then we offer standard plans, which are standardized in the state of Vermont. We offer 14 different plans. There is one plan that does have an age eligibility requirement, the catastrophic, which is more of an introductory health insurance for those under the age of 30. Go to the next slide. So one of our unique plans is our Vermont Preferred product. With these plans, they provide exclusive benefits, including our 369 doctor visit, as well as select chronic care services for those members that may be diagnosed with diabetes or heart disease. So the 369 combined doctor visit is based on the number of people enrolled on your plan, but it allows you those visits with a primary care physician or a mental health counselor or a substance abuse counselor at no cost to you before you meet the deductible on the plan. So if you're on a single person plan, you have 3 visits. If you're on a couple plan, that's 6 visits. And then if 3 or more family, that would be a total of 9 visits. As well as the additional no cost visits for select chronic care. We allow 3 visits per member with certain providers if you have been diagnosed with diabetes or heart disease with our Vermont Preferred product. You can go to the next slide. So some of the benefits that you receive with Blue Cross Blue Shield Vermont is our strength of our Blue Cross EPO network. So that allows you to have services across Vermont as well as the US with Blue Cross Blue Shield preferred providers. So Blue Cross is an association with states having different Blue Cross plans, so you have availability of providers anywhere in the US. We have our Vermont Blue RX pharmacy benefit. We also offer a telemedicine with our partner Amwell, and you do have health and wellness programs and services included with your product, as well as a member portal to review your benefits and claims and services. So if you have any questions, again, as Zach and Sean mentioned, open enrollment begins November 1st. So if you're interested in learning more about what Blue Cross offers for products, if you qualify for subsidies, or if you don't qualify for subsidies, you're able to buy plans through Blue Cross directly. We're here to help starting November 1. You can reach us by phone or email, as well as we have extended open enrollment hours from Monday through Friday, 8 to 6, as well as will be available Saturdays from 9 to 12 by phone. So that's the last slide I have. If you have any questions, let us know. We'll have a Q&A after the presentation.
Fantastic. Thank you so much, Jordan. And like Jordan said, we want to make sure that you're able to ask them questions. So we will have opportunities in this town hall for you to ask Blue Cross Blue Shield of Vermont questions. we're also going to be conducting a specific, more in-depth presentation with them next week on Tuesday. And we'll share information about that online on our website and on our social media platforms. So we will be able to get more in depth and ask them specific questions about their plans and their programs at noon on Tuesday next week, hopefully giving people plenty of time, given that it's the first week of open enrollment, to jump in. So now I am going to introduce Kelsey Thornton and Kristen McDowell. I think, Kelsey, you'll be taking the lead in the presentation, and I'm just going to bring up your slide deck right here.
Thank you, Zach. So while Zach's getting that up, hi everyone, my name is Kelsey Thornton and I work for MVP Healthcare. I'm the liaison between Vermont Health Connect and MVP. I'm briefly going to discuss some of our 2022 plan highlights as we enter this open enrollment period. And I also have Kristen on the call to help answer any specific questions there might be on our Vermont plans.
Thanks. Sorry, just having a little bit of tech issue here, but we'll be up momentarily.
No problem.
Well, Zach works on getting the MVP piece up, but just curious to ask from any of our partners here how folks in the offices or with your members calling, or you hearing kind of, does it feel like normal open enrollments, or you feeling folks feeling a sense of excitement or difference given the sense that the plans are more affordable than any of the other 7 or 8 years we've been doing this? I guess we can hold the answers there. That probably Murphy's Law, right? As soon as I started talking, that would get it up. I'll pass the baton back to Kelsey. We'll circle back to that in the Q&A.
Yeah, my apologies for the delay. Go ahead, Kelsey. But I am curious to hear the answer to Sean's question. Maybe we can get to that in Q&A.
All right, sounds good. So we do have some new and exciting features to add to our plans this year. Some of the highlights are listed on this slide. First off, we have our virtual physical therapy, which is an awesome new feature that we're adding, and that is the ability to enjoy the freedom of physical therapy on your own time, anywhere, and at no cost to you. So there's no in-office appointments with that. You can have direct access to a live, dedicated physical therapist to create a personal plan for you. And we think that's really great, especially with everyone, a lot of people working from home this year. You can do that on a lunch hour, before or after work, and there's no commuting to and from an office. So that's pretty great. The next thing we have is a new vision plan provider. We're now powered by iMed, and we will talk about that at a later date next week. We now offer a $500 acupuncture allowance on our non-standard plans, which is something that is new and highly requested by our members. So we're excited to add that. We also have the $600 well-being rewards on our non-standard plans. This is returning and continues to be very popular amongst the members. They can receive up to $600 per contract per calendar year, and that's for completing health and wellness activities that most people already do, whether it be, exercising at a gym or logging steps. We have a reimbursement portion of this benefit, and we have some new items that are going to qualify for that this year, and we're excited to share those next week as well. And lastly, we continue to waive our HSA maintenance fees for individuals who are enrolled in qualified high deductible plans. You can go to the next slide here. So GIA is a new platform that members can access from the web, by phone or mobile app. There's so much to do with this platform. Members can request prescription refills, schedule blood tests, and utilize so many resources to research and treat their own symptoms at home. There's an access to nutrition information, and there's a 24/7 emergency and urgent care portion of this as well. So, say it's the weekend and you can't get into a doctor's office, you are able to go on here and read, at-home remedies until you can get into the doctors. You can also be referred to a doctor through GIA. So it's really a one-stop place for everything. I personally think this is such a great addition because so many times we just are Googling our symptoms and a bunch of scary things can pop up suggesting what might be wrong with you. And those Google results aren't the most trusted answers out there, but with GIA, you can really trust that these answers are from real doctors and not just anyone on the internet. And like I said, that's available 24/7, and the website is listed on this slide. And last slide here, we're just continuing to remind everyone of VBID. VBID is our Vermont value-based insurance drugs. We just call them VBID. These are available to members at a $1 or $3 prescription drug copay, and that's for a 30-day supply on most of our Vermont non-standard plans. There's a link on this slide where you can access a list of all our current drugs. And then again, we continue to offer the $0 generic for kids up to age 10, which is another amazing plan benefit we have. And I know we're going to have a more in-depth conversation next week where I'll go through a lot more of our plan benefits here in more detail so everyone can have a better understanding of what we have to offer this year.
Thank you so much. That was great overview. And yes, next Friday, we will be doing a more in-depth overview, and we'll have the opportunity to dive into the different options and what MVP is doing for its customers. But also, certainly, we can answer some questions at the end of this event as well. Okay, let me see. Let's go over to Kathy. And I believe she's with Debbie too at Northeast Delta Dental. So I want to introduce them, and I am going to try to more quickly make this transition this time. But
as you get their slides up, Zach, I'll just point out quickly on the point that Kelsey and Jordan were both making. They're talking a lot about the plans there, and you heard Kelsey talk about non-standard plans. That's something with the non-standard plans and standard plans we didn't talk about, Zach, when we talk about the terms at the beginning, but that's something good for folks to know is that standard plans are the same across issuers, that they're specified by the state, and the non-standard plans give the insurance companies more flexibility in what they put in. And so when you go to that plan comparison tool for MVP, you'll see the non-standard plans are called MVP Plus. It may not say non-standard, it'll say MVP Plus. That means it's a non-standard plan. And Blue Cross is be the Blue Cross Select and the preferred plans, distinguish them from the standards. So certainly encourage you to come to those sessions next week for the deeper dive. But if you want to look at the plan comparison tool and look into those plus and preferred and select plans between now and then, that would be a great thing to do. And you got it up quickly this time, Zach, so I'll stop talking.
All right, thank you very much, Sean and Zach. Now, the Northeast Delta Dental plans, if you want to go to the next page, one of the biggest changes is with the pediatric plan year maximum out-of-pocket. It's increasing from $350 to $375 per child, and from $700 to $750 per family. This is for the pediatric patients, which include enrollees under the age of 21. So, and of course, if the enrollee turns 21 during the benefit year, they are included in this as a pediatric enrollee for this benefit year. For the plan year maximum out of pocket, only expenses incurred for covered services received from a Delta Dental preferred provider organization dentist, or a PPO dentist is what we call them, and you'll see reference to that in our outline of coverage that's showing right now. That accrues toward the maximum out of pocket. We do have a Premier network, which is not the network for this Delta plan, but patients can go to a Premier dentist and still get a benefit for the Premier dentist. It just does not accrue toward the plan year maximum out of pocket. Once that maximum out of pocket is met for the pediatric patients, the plan then pays 100% of all the covered procedures within the plan. So that's the beauty of our plan with Vermont Health Connect. Some of the other fun things that we're doing, our network is our strength. If you need to find a PPO dentist, you can go to our website and hit find a dentist and find it there. If you are looking for other plans, if you go back a screen, the available plans, these are individual and family plans that are offered in Vermont. These are in addition to the Vermont Health Connect plan that have different benefits for different patients. The big benefit with the Vermont Health Connect plan, of course, is the pediatric dental requirement, which is one of the top 10 requirements through the Affordable Care Act that we have right now. But there are a variety of other plans that are available to people in Vermont. And of course, with the Vermont Health Connect plans, we are looking forward to the change in premium, where we will be collecting the premium directly from the subscribers starting with the January 2022 month that's collected. So that brings you into us. We love talking to you, of course. If you've got any questions, certainly give us a call. We're at 1-800-832-5700, Monday through Friday from 8 a.m. to 4:45 p.m. So lots of good information and lots of wonderful things happening with our dental plans in Vermont. Thank you.
Fantastic. Thank you so much. And we're going to send it into any questions. So for those who haven't posted a question yet and you'd like to, we'll give you a minute to post your questions for either Sean or myself or any of our insurance company representatives who has joined us on the call today. Again, I want to just reiterate that we will be having 2 follow-up presentations next week, with both Blue Cross Blue Shield on Tuesday and MVP on Friday, both at the noon lunch hour. And those are going to dive deeper into the various offerings that each company has. The other thing I wanted to mention was that, again, this is the first of 4 town hall, open enrollment town halls that will be happening, and that they're all recorded, so that if you are sharing this with friends, family, colleagues, coworkers, you are more than welcome to share it on our website. We want to get this information out. It will be posted on our website, and we will send out social media postings that indicate and direct you to where you can find the recordings of this content. We realize that this time might not be perfect for everyone, so that's why we're trying to be really proactive about getting it up on our website, because this allows people to hear the presentations and learn information virtually, by video, by town hall experience, which may be an easier way for some folks than visiting a website. Sean, anything you want to add before we jump in? I know you had a question for the carriers. I don't know if we want to circle back to that, or if there's anything you want to go to first.
Yeah, I think if we're still waiting for folks to input their questions, if there aren't any in the queue yet, I think I'd like to turn to that while people enter it. And on the point of questions, we just add that I think for those deeper dives with Blue Cross and with MVP next week, right, we'll get those links to the events up by the end of this week, right? So if people can't make it for whatever reason, but want to get a question in and catch back up on when it gets posted to YouTube, and think of a question this weekend, you'll be able to, you can post those questions ahead of time too. You don't have to wait for the event. But yeah, just following up what I have, I'd love to hear from either Kathy or Debbie or Jordan and Cindy, Kelsey, Kristen, just what you're hearing around the office, what you're hearing from people on the phones, just because I know it's it's kind of an exciting time and a different time from what we're hearing, just anecdotally, the stories about about people who are able to move into plans that have lower out-of-pocket costs and still pay less than they were before, and then maybe get some of that health care that they've been putting off in previous years. Hearing about people who are taking that, as we talked about, you can't use the financial help directly for the dental plans, but people, if they're paying that much less on their health plans, the medical plan, taking some of that savings and using it to get the dental insurance too. We're hearing from people who hadn't signed up, hadn't transferred their plan over from direct enroll because they thought their income was they're usually too high to get any kind of subsidies and financial help, or figured if they got a discount it would be $5 or $10, and then being pushed by a friend to give a second look and finding out that they're saving $500 a month or more. I mean, it's not chump change. So really exciting all the way around. And then the news that came out last month nationally that Vermonters on average who are paying less because of these American Rescue Plan tax credits are saving about triple the national average. Vermonters are saving more than any other state, about $186 per person per month. But I'd love to hear what all of you are hearing with either people who call in or anything else.
Hey Sean, it's Kathy from Northeast Delta Dental. We did get a couple of calls when the American Rescue Plan came into the news. And what we did is we referred people back to you, to Vermont Health Connect, to go through and fill out all that information and see if they had an available credit. And we were telling them that it was amazing at how high the household income is that people were getting that tax credit. So don't think that you may not qualify based on your income. Go right ahead and contact Vermont Health Connect and ask about it.
Great. Yeah, thanks, Kathy. That's a great point. And it really was a huge shift, right? I mean, we're talking for an individual before, if you're earning about $51,000, that was a cliff. You didn't get any financial help. And as we mentioned, for 2022, an individual in a single plan up to $105,000, that's certainly most Vermonters can get some financial help now. And yeah, that's great that folks were calling, and I think making the connection to the dental plans too. Jordan, I see you lighting up too. Were you gonna jump in on thoughts there?
Yeah, so what we're hearing is from our direct enroll population, calling in about their 2022 options and we're fully explaining that, if you're a single, it's increased by 10,000 from 95 to 105,000 for next year. Even the family has, almost jumped up $30,000. So people that may have not taken advantage, for those ARPA subsidies in 2021 are certainly making that connection for 2022 because of the new year. So we're getting a lot of, feedback that, hey, maybe I should, actually do this to get a lower monthly premium, and essentially it will allow them to upgrade to a better plan with those subsidies than paying full price for a bronze plan. Now they can get the gold and have a lower deductible. So there's a lot of connections that being made with the new subsidies for, once January 1 starts.
Yeah, thanks, Jordan. That's a great point too, that I think we talk a lot about American Rescue Plan making such a huge difference for 2021 and 2022. And as we were just hearing from Northeast Delta Dental that people were calling a lot back in the spring when that went into effect. But yeah, you make a great point, Jordan, that even looking at 2022 compared to the post ARPA 2021, that's a significant shift, and 2022 will be even better and cover even more people with even higher incomes. So even if you looked in the spring or summer, it's a great chance to look again and take advantage even more so in 2022. Thank you for reminding everyone of that. And Kelsey and Kristen, anything that you're all hearing on the MVP side?
It's been pretty quiet on the MVP individual sales as far as questions go, but I am referring those looking for new plans to the Vermont Health Connect because they are shocked when they hear the amounts of the income limits.
Great. Yeah, thank you. And hopefully that does pick up. And I know both your team and the Blue Cross team have done a great job of reaching out proactively all spring and summer, and now as we get into fall and open enrollment to those folks who are direct enrolled. So I would encourage everybody who's watching this too, if you know anybody who maybe has a somewhat higher income and signs up directly with the insurance companies and maybe doesn't always open their mail, because I think we're all guilty of doing sometimes. I certainly am. when you assume what might be in there and don't know that it's potentially a savings of several $100s a month, thousands for the year. So we want to really encourage all Vermonters to take that additional look. And Zach, your questions coming up? Thoughts? Yep.
Yeah, I do. One thing that we hear is, okay, I'm going to make this transition from going directly to the insurance carrier to Vermont Health Connect, and I understand I can get some savings, but what about the plans? And I know that our carriers have outlined them, and we've talked about this, but can you help reassure folks? What if I'm concerned about getting a plan that's as good, when I come to Vermont Health Connect, if I'm used to going direct to the carrier?
Yeah, that's a great question, Zach, and it's a really easy answer because they're the same plans that are offered through Vermont Health Connect, as people can direct enroll with Blue Cross or MVP. And so not only are they the same plans, that also means that you don't have to wait to open enrollment. As you talked about earlier in the presentation, this is really the exciting time of year, and for most people, it's the time to act, because if you don't sign up by the end of open enrollment, by that January 15th this year, but certainly again December 15th, in order to make sure you have insurance all 12 months next year. If you don't sign up by January 15th, in many cases you have to wait. You'd be waiting for 2023 unless you have a special event, a life event that allows you to sign up earlier. And so that's kind of the important thing about open enrollment. But actually, with people who are direct enrolled, because they are the same plans, and it's just a matter of whether you've signed up directly with the insurance company or through Vermont Health Connect, there's no difference in the plans. You can change the administration of your plan at any time. You can transfer it from Vermont Health Connect to the insurance companies, as many people did in years past if they wanted to be billed directly by their insurance companies. But now, because people at much higher incomes, as we've discussed, can get financial help when they sign up through Vermont Health Connect, number one, and because they're going to be billed by their insurance companies regardless, it really should make it a much easier decision for just about everybody to sign up through Vermont Health Connect. Make sure you're getting those lower costs for the same exact plan, and being billed by your insurance company. And as was just going there too, you don't have to wait for open enrollment, even though we're just about there. But if you are direct enrolled and want to transfer your plan, you could do so today and be effective for your November and December coverage and save money for those 2 months, as well as next year. Everything you've already paid toward your deductible to your insurance company will still apply when you transfer your plan.
Thanks, Sean. That's helpful clarification and hopefully reassuring to many. So I think, excuse me, in the interest of time and to just kind of cap things off, you know, I'm just going to reiterate what we've heard today in terms of important dates, that this coming Monday, less than a week away, November 1st, is when the open enrollment period begins. And like Sean said, we want you to focus on those first, you know, that first month and a half, so that you can get a plan for the beginning of 2022, January 1st, 2022. I want to thank all of our insurance company representatives today. I want to thank Sean and those behind the scene who helped put this together. Again, this has been recorded and will be shared on our website and through social media. And we have follow-up events next week with MVP Healthcare and Blue Cross Blue Shield of Vermont to elaborate on their plan offerings. And then don't forget our 3 additional town halls that will dive into more depth around how to enroll and choose your plans, etc. Additionally, one last plug is that if you or your organization are looking for more information and would like us to come speak with your group, we'd be happy to do so. You can always contact us with questions or inquiries through our email address found on our website, and we would be happy to connect with you to share more information. So I will leave it there. Again, thank you to all for joining today, and until next time, have a good rest of the day.